Hi, Emily here from Study in Australia TV. Today we're going to talk about what it's like to be a nurse in Australia. Nursing is a rewarding and multi-skilled profession in Australia. Nursing not only has a variety of fields you can specialise in, it also has many different healthcare settings that you can work in and employment options to choose from. What's it like to be a nurse in Australia? Nurses provide medical and nursing care to patients. Nursing care can be provided in hospital, at home, or in outpatient facilities. Nurses work together in a care team that includes doctors, therapists, and social workers. The nursing profession includes roles such as enrolled nurse, registered nurse, practice nurse, theatre nurse, mental health nurse, midwifery nurse, and clinical nurse. Some of the tasks and duties you can expect to perform as a nurse are planning and creating a care plan for patients, taking and recording vital signs such as patient temperature, blood pressure, heart rate and blood sugar, collecting patient samples, providing pre- and post-operative nursing care, writing care notes, providing emotional support to patients and relatives, administering and monitoring medication and intravenous drips. Nursing is generally a good fit for those who love working with people and are interested in health and work well in an environment that's constantly changing. Nurses need to have strong communication skills, be organised, and work well with others to meet the demands of this job. They can be required to work shifts at all hours, so flexibility is important. So what's the current nursing demand like in Australia? Australia forecasts that in the medium to long term, the demand for nurses in Australia will exceed supply. Reports estimate that by the year 2025, there may be a shortfall of approximately 85,000 nurses and about 125,000 by 2030. If you're considering being a nurse in Australia, your qualifications are likely to be in high demand. The high demand for nurses in Australia means that there are a wide variety of opportunities available. Many jobs are located in rural areas that are underserviced, but there are many placement in urban areas such as midwifery, mental health, nursing home, and aged care, as well as critical care nursing, paediatric and forensic nurses. How do you become a qualified nurse in Australia? To become a nurse, there are two different pathways to choose from: enrolled nurse and registered nurse training. To become an enrolled nurse, you will need to complete a diploma in nursing. To become a registered nurse, you need to complete a Bachelor of Nursing. Alternatively, for students with previous tertiary qualifications, you can complete a 2-year Master of Nursing or Graduate Entry program. All nurses must apply to the Nursing and Midwifery Board of Australia, also known as NMBA, to be able to work in Australia, and your registration must be renewed annually. Let's look at some of the study options for nursing. Starting with the Diploma of Nursing. This qualification prepares you to work as an enrolled nurse. Most Diploma of Nursing programs are 1.5 to 2 years in duration. A Diploma of Nursing will prepare you to provide expert nursing care across different health sector settings. You will learn anatomy and physiology, infection control and medication administration to work in a range of healthcare settings, including acute, aged care, rehabilitation, and mental health. The Diploma of Nursing theory and practical coursework will teach you to care for a person with complex needs, effectively communicate with patients and colleagues, implement, monitor, and evaluate nursing care plans, tend and manage to wounds in the clinical environment, and work within legal and ethical parameters. There are 24 institutions that offer a Diploma of Nursing in Australia. Now let's look at the Bachelor of Nursing. This degree provides you with the skills and knowledge for a career as a registered nurse. Bachelor of Nursing programs are 4 years in duration. You'll develop the knowledge, clinical skills, and attitudes needed for professional practice in a range of settings and benefit from a strong focus on theory and practical experience. Generally, the Bachelor of Nursing will focus on integrated themes like nursing practice, including safety and quality, cultural safety, evidence-based practice, professional communication, consumers as partners in care, and teamwork. You'll also learn about cultural competence, evidence-based practice, mental health, primary health, professional communication, and safety and quality. Most Bachelor of Nursing programs require 1,000 hours of nursing placements from your first year of study in clinical settings. There are 29 institutions that offer this program in Australia. Let's look at job opportunities for nurses in Australia at the moment. There are over 14,000 nursing jobs currently advertised on Seek at the moment, and the projected job growth over the next 5 years is 15.6%. The typical salary for nurses in Australia is around $90,000 per year. For international students, it's important to know that you need a high level of English to study and work as a nurse in Australia. There are ways you can improve your English by either studying English in your home country or coming to Australia to study English before you start your nursing course. This is the best way to improve your English. Ask us at Study in Australia TV for advice on studying a nursing program in Australia. You can post a comment or go to the studyinaustralia.tv website and fill in a contact inquiry form. We'll help you to find the right program that suits you. We look forward to hearing from you soon. Bye for now.